In informed consent discussions, physicians are documenting and explaining the risks and the benefits of going through a procedure and the risks of not going through the procedure. When the patients refuse the proposed treatment, it is called informed refusal. But in order for the refusal to be informed, several things have to be documented. Now, treatments can be refused for a number of reasons. There are often short-term, acutely needed treatments such as mechanical ventilation for respiratory failure. There may be treatments that are needed within a couple of weeks, such as a coronary artery bypass surgery. And then there can be treatments that are needed within the month or two, such as chemotherapy or surgery for cancer. Now, patients can refuse treatments for a number of reasons. There are religious reasons for why patients would decide against going through the planned or offered treatment. Jehovah's Witnesses, for example, will not accept blood products from humans, and they will verbalize that. As long as they verbalize their understanding of what would happen, the consequence of what would happen if not receiving a blood product, that is called informed refusal. They have the right to refuse. Physicians have the right to hold discussions. Now, we have to discuss capacity. Capacity is important, and it's not always easy to determine. In a capacity evaluation, the physician has to take into account the patient's ability to understand the risks and the consequences of going through the appropriate procedure or even refusing the procedure offered. Now, how do your medical conditions impact your capacity? So there are medical conditions that are usually temporary, what we call acute. Examples include a patient has been picked up from a motor vehicle accident site by the ambulance service. They've been brought into the hospital and they're losing a rapid amount of blood. Their blood pressures are dropping, their oxygen levels are dropping, they are confused, they're delirious, they can't really focus, but they're continuing to refuse. That patient may not have the capacity to refuse treatment. Another example would be, let's say a patient comes into the emergency department with pneumonia and they're struggling to breathe, which is why they came into the ER. They want to be admitted, they want to get better, and they want to go home. A few hours later in the ICU, they develop oxygen worsening. Their oxygen levels are now dropping. 90 to 100 is normal, but theirs are dropping to the 80s and 70s. Their blood pressures are also affected. The doctor is about to offer them mechanical ventilation. They freak out, panic, and start refusing. In that particular situation, they may also not have the capacity to make a medical decision of acceptance or refusal. Now, there are a number of medical conditions that can compromise your ability to make decisions, such as low oxygen levels, active hemorrhaging, as in our example above. Think of being under the influence of medications such as anesthesia or sedatives, or let's say you're going through a drug withdrawal or an intoxication. Any of these medical states can compromise your ability to decide and to even refuse life-sustaining treatment. If the treatment is life-sustaining, it will likely not be withheld unless you have previously supplied them a document stating you did not want that treatment, or you have a medical power of attorney stating that you didn't want that treatment. Now, there are some medical conditions that are chronic, such as dementia or worsening stroke. In mild forms of dementia, patients do have a sense of awareness, and they have only mild limitations on their ability to function in life. They're able to take care of their self-needs, and they're able to perform some basic finances. But as the dementia progresses, their ability to even hold a coherent conversation is severely challenged. And at that point, an advance directive or medical power of attorney needs to kick in. Now, when it comes to documenting a surrogate, we have to be able to establish that a medical decision maker is warranted. We document these discussions, and we will document when a patient refuses a treatment. In the case of refusing a treatment and the patient does not have the capacity to make a decision, we will look for an advance directive or a living will, and we'll even look for a medical power of attorney or a surrogate. The advance directive takes precedence. I hope this video has shed some light on the ability of patients being able to refuse treatments. They are able to refuse treatments. We will assess your capacity to refuse. Please take this as an opportunity to make an advance directive now. Specify your wishes on medical treatments and plan. Help your future selves out, your family members and your doctors, when it comes to having to make a decision either way about important life-sustaining treatments. Until next time.